You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Cathy Biase.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Cathy Biase, and I am a holistic nutritionist and a professional cancer coach. As we continue to move to a more integrative healthcare system, the rise of chiropractic work and its potential for profound positive systemic effect has been apparent, but many of us still do not have a grasp on the breadth and depth of its health benefits. And we take aim at that on today's show with Dr. Glenn Jaffe. Since receiving a Doctor of Chiropractic degree in 2002 from National University of Health Sciences, Dr. Jaffe has owned and operated Jaffe Chiropractic in Charlotte, North Carolina since 2006. Aside from caring for thousands of patients from birth into golden years, Dr. Jaffe has served the chiropractic profession in various capacities over 9 years as a member of the North Carolina Chiropractic Association board, including 2 years as president. During this time, he was honored by his peers as the 2014 NCCA Member of the Year and NCCA 2001 Doctor of the Year, as well as receiving the Legacy of the Longleaf Pine in 2022, which honors many years of service and effort to the advancement of chiropractic in North Carolina and service to the NCCA. He currently serves on the board for ChiroCongress, a national association advocating for chiropractic. Dr. Jaffe, his wife, Tammy, and their 2 daughters reside in the Charlotte area where they enjoy all the trappings of life in the Carolinas. On the show today, we talk about what chiropractic work is, who can really benefit from it, its systemic effect on health. We talk about the nervous system. A whole lot is covered in this show. Please stay tuned with us. We'll be back in just a few minutes to talk with Dr. Jaffe.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Cathy Biase.
Welcome back to the show, everybody. Today's show has been pre-recorded, so no opportunity for calling in. Please do follow us on our social sites. We are on Instagram, Twitter, and Facebook, and we are at the Health Hub RMC on all 3 locations. Dr. Jaffe, welcome to the show.
Good morning, good afternoon, good evening. Thank you.
Yes. Wherever you are, happy day. Chiropractic work. Now, this is something, we were talking off air a bit, something I've taken much more of an interest in recently. When I was a kid, I had chiropractic work done. And I know that it has evolved quite a bit since when I was a kid. But how did you get into this line of work? It seems to be becoming a lot more recognized and popular as a method of treatment. How did you find your place?
Interestingly enough, I was a teenager and started having headaches, and my parents had been chiropractic patients for a long time, and we were finding that we weren't really being able to find anything to help me relieve these headaches, and it was keeping me out of school and affecting my quality of life as a teenager. And so they decided to take me to their chiropractor, and that was the only thing that really started to make a significant difference in the frequency and intensity of the headaches I was having as a teenager. And that was really kind of my first experience firsthand of receiving chiropractic care. And I started to carry that with me throughout the rest of my teenage years. And I originally went to college and undergrad as a nursing major. I wanted to get into anesthesia. And my mother was a retired nurse anesthetist. And I thought that was something that would be interesting to me. I'd still be able to care for people and be in the medical field. And so I started the wheels going for that. And I realized that the medical model and being in that hierarchical ladder was not what I wanted to be. I wanted to be in a position to decide what to do for the patients. I wanted to be a decision maker. And I was traveling home for American Thanksgiving one year at undergrad and went to go get adjusted my chiropractor at home. And he was asking me how school was going. And I told him that I was not really going to do nursing anymore. I was trying to figure out what to do. And he said, well, have you thought about becoming a chiropractor? And I looked at him and I said, no, I hadn't even thought about that at all. So we went to lunch. He told me about everything. And it really sounded great because my perception of healthcare at that point was still very much in the medical model. My father was a dentist. My mother was a nurse. My grandmother was a nurse. A lot of family members were dentists and doctors and nurses in my family. So that's all I knew. And I started to get into it and realize that this was really, really what I wanted to do. It was a way to help people, to care for people. It was a very conservative approach. At the time, I realized that drugs and surgery and everything else that we commonly associate with Western medicine is maybe there is something else there. And so I started that journey into school, and that's kind of how I got started in chiropractic. Was my own personal experience.
Well, a lot of us get started that way. We have something happen, shift, and come into these places. How has chiropractic work evolved since you started as a kid? Because I know I took my daughter to a chiropractor. She was playing soccer. And anyways, I took her to a chiropractor and he was using paddles and things to adjust her. When I went to a chiropractor, it was all hands on. Has it evolved a lot, or was this just a particular chiropractor that used this type of mechanism?
I think probably a little of both, but the easiest way to explain it is that chiropractors generally, we're all trying to accomplish the same thing. It's just that there are very, very numerous ways of adjusting the spine and reducing stress on the body. And that's what the individual doctor does. You go to your primary care doctor and you can pretty much expect to give them a prescription or a referral or blood tests. Very much the same approach. You could go to 4 different chiropractors and get 5 different approaches, all trying to accomplish the same thing. But the longer anything exists and the more people have experience with it, the more kind of research happens, the more understanding of things happen, the more best practices come about. And I think in my 20 years of practice, there's been a lot of understanding about how the body really works. And we've been able to understand at a higher level some of the more theoretical things that chiropractic has espoused since it started over 125 years ago. But the science, the research is really validating so much of it. And really, ultimately, the nervous system does control and regulate every single thing that happens in the body. And we are able to show now quantitatively that is the truth. And the chiropractic adjustment really affects the nervous system. And that really hasn't changed in the 125 plus years that chiropractic has started. The application and the communication of chiropractic has certainly evolved. And I think that's probably the biggest thing that people can notice for sure.
Okay. So to back up here a bit, you're manipulating the spine and the neck. Is that considered the spine in your world?
Yes, but
okay.
I want to correct you with one word.
Manipulating.
Manipulation versus adjustment. So in chiropractic, the way that I practice it is I try and be as extremely specific. And the only way to be specific is to use the adjustment. Manipulation, I think it lends to maybe a more broad approach. It's not specific. It is trying to do something. And, manipulation in general has maybe a little bit of a negative term anyway. None of us like to be manipulated when we're buying a car or anything like that. But so I prefer to use adjust if we could going forward.
No, yep. Adjust it is. And you can adjust my questions too. That's perfect. Okay. So an adjustment, are all chiropractors doing the same thing, but with different target results? Are you trying to align the spine and we'll go into some of the results and things, the systems that are affected. But are you doing the same thing?
I think the end result broadly is to improve function in the body. And that's what the chiropractic adjustment does. Now, some doctors of chiropractic are very focused on pain or symptom relief, and that's where they leave it. And some patients that's what they're attracted to. There are also chiropractors out there, more of the line of thinking that I view things is that we get past the point of improving function or helping with symptoms, but we improve the body's ability to adapt to its environment and function at a high level, which is how it's supposed to be. So chiropractic takes a patient through the spectrum of symptom relief all the way through what we call wellness or support, essentially, is helping to keep the body working at its optimal level. So depending upon what your goals are as a patient, that may influence how you seek out your chiropractor when you're looking for it. But the end result is to improve the body's ability to heal no matter what.
So working with the nervous system, working with the spine, can you impact all systems of the body?
Yes, and here's how. We know and we understand now, and the science proves it, that the brain obviously controls and regulates every function in our body. The brain works a lot like a computer. When a computer starts to get old or starts to get overloaded with extra information like viruses, malware, spyware, bloated apps that don't work anymore, it slows down the computer. It makes the computer work less efficiently. We've all turned our Windows machine on and it sits there and takes 2 hours to load, whereas remember when we bought it, it pushed the button and it started right up. The body, the brain is the same way. The more noise, if you will, the more interference in the nervous information coming into the brain there is, the less efficient the brain will act. And when the brain can't act efficiently, it's still trying to do its job. It just doesn't do it as well. And that's when we start to see the change in function. And eventually we start to see those symptoms. So to answer your question, yes, chiropractic influences the nervous system to do its job better by removing the interference or the stress that is causing it not to work well.
That's really interesting. We're going to talk about some of these things. I think we'll leave that to the second half. What are the biggest myths you'd like to bust right now as far as chiropractic work? Just keep it in the chiropractic space.
Sure. Well, I've heard lots of things over the years. We're not real doctors. That's interesting because chiropractors go to school for as long as medical doctors and osteopaths do. We have the same amount of hours. We have similar hours in anatomy and physiology. One of the things that's divergent in our education is the amount of time spent studying pharmaceuticals. And obviously, the chiropractic, we don't prescribe drugs. It's not in our scope of practice. It's not how we practice. So we don't really spend a lot of time studying that. Instead, we spend a lot more time studying the function of the body, understanding the skeletal system, the muscular system, in a biomechanical perspective, and then obviously spending thousands of hours learning how to adjust the spine and other parts of the body. So that's one of the biggest myths. Another myth is that all we do is break bones. That's obviously not the case, because if that was the case, nobody would be able to practice chiropractic anywhere in the world. It's very safe. Another misconception about chiropractic is that it's only for neck pain and back pain. And that's probably the biggest hurdle that I think we still as a profession are still trying to overcome. Is society likes to put labels on things and puts chiropractic in a little bit of a box where it's only good if I have headaches or neck pain or low back pain. But my 3-month-old is throwing up every time he eats. I don't know why, and I can't go to the chiropractor. That's not going to help. That he doesn't have back pain. Why would I go to the chiropractor? Or my teenage son's got asthma. The chiropractic's not going to affect that. The reality of it is the chiropractic really doesn't. We're not treating symptoms. We're not treating diseases. We're looking to improve the body's natural ability to heal and function. And that's a big contrast to Western medicine, the medical paradigm of broke fix. And I think that's probably the biggest misconception.
Well, when it comes
recently,
sorry,
go ahead.
No, you go ahead.
I was going to say, and then we could dive into what you see on social media now with TikTok videos and reels and things like that. There's a lot of stuff that's out there just to get attention, and I don't think that doesn't help. That doesn't help people understand what happens. So there's a lot of sensationalism too.
Like lifting somebody up and having their back crack. That's
Yep.
chiropractic manipulation. No,
Yeah.
adjustment. That's
Yep.
manipulation, not adjustment.
Yeah, or hearing the stories about, I went to the barber and he cut my hair and then he twists my neck both sides, makes a lot of noise, and I give him $30 and I leave.
To be fair, and this
Yeah.
just happened to my son. He's recently started with a chiropractor, and he started for shoulder pain. He dislocated his
Yep.
shoulder, and so he's with the chiropractor. But he's also he lifts, so he lifts
Yeah.
heavy weights, and so he went to the chiropractor thinking, well, okay, let's see if he can help me with my shoulder, and then he came out with an adjustment, neck and everything. And he said, honest to God, I think I can hear better.
Yeah.
And it was like, hear better. And he said, yeah. But to be fair with these adjustments, he said the noise and sensation that went through my head when he twisted my neck was unbelievable. And it does take it can be a little shocking, your first adjustment, for sure. But someone who's an athlete, who's working hard, pounding all the time, or, to me, this is a big area that maybe some athletes don't quite grasp, is to getting adjustments, because you're putting a lot of stress on the body. And then, unless you're a perfect athlete, there are probably some strengths, some weaknesses, but this is a big space. Do you see many athletes come into you for adjustments?
Absolutely. And not just in my practice. The utilization of chiropractic in general is very, very high in professional sports, collegiate sports. Every NFL team has a chiropractor on staff. I'm fairly certain every NHL team, every Major League Baseball team has a chiropractor on staff. Almost every Division I college football program in the United States is going to have chiropractors either on staff or affiliated with them. So the professional athletes are, especially in the Olympics, same thing. They take what they do very seriously, and their job is to make their body work as best as they can. They realize that chiropractic is an integral part of, not the only thing, but an integral part of their ability for their bodies to work at the highest level possible. And, for various reasons, chiropractic care helps you recover from injuries faster. Chiropractic care helps to improve range of motion, flexibility, which is going to help performance. So if you're a high-level athlete or a weekend warrior and you want to reduce your recovery time, if you want to increase your performance, if you want to reduce the risk of injury, chiropractic needs to be a part of your routine.
And the fact that teams are hiring and it's pervasive in all sports leads me to understand, and everyone else too, I'm sure, that this isn't, okay, come in, we'll have an adjustment, you'll be fine. This is a continual, constant thing with athletes for sure. But if someone is working with an injury or who's not an athlete working with you, I assume that it takes time. Are you ever fixed, or is this something that you work with time and time again? It takes some space to get to where you want to be.
That is a great question, Cathy, and that's probably one of the struggles as a provider that we have when patients come into us. They want that magic fix. They want that magic bullet, the magic wand. I was joking with a patient this week. I said, if I was the person who could invent that magic wand, I would both make everybody in the world really happy and probably be the richest man alive. But neither of those two things are going to happen. The body doesn't respond that way. And in my practice, I use a lot of analogies to help the patients understand. And if we could back up one question or two questions ago, I think one of the struggles my profession's had for a long time is explaining in words that people understand what we do and what chiropractic does to the body. And I've learned over the years that if we use analogies and we use language that people understand, it helps, just like in any situation, it helps them to connect with you, and it helps them to understand faster and in a way that they're willing to accept what you're giving them. So in my office, I like to use the analogy of a broken bone. So if most of us have either broken a bone or know someone who's broken a bone, and you have to typically wear a cast. Let's take your arm, right? You fall on the ice and you break your arm. Well, you got to put a cast on it. And initially your broken arm hurts a lot, right? But as soon as that cast goes on, what happens is the body starts the process of healing. That process takes time and it takes repetition. And you have to leave that cast on for about 8 to 12 weeks. The body needs time to do its job. Now you're going to start to reduce pain. You're going to start to feel better. Things are going to change as we work through those 8 to 12 weeks with that cast on, but you don't take the cast off until the bone is healed, even though the pain goes away. And that analogy helps a lot of people understand that it's not the symptom abatement that we're looking for. We're looking for the body to function and to do its job. And then once the cast comes off, the body's ready to go. In the case of what we do with our patients is we want to, ameliorate those symptoms, but at the same time, once the body is working better, you want to maintain it. So another analogy I use is the analogy of braces. So you wear braces on your teeth, the teeth move into position. Everybody knows that takes time and repetition, right? You have to go to the orthodontist and get them tightened every so often. But once the braces come off, because you don't do the braces for the rest of your life, you have to wear a retainer. And the reason you have to wear that retainer is because the body likes to return to the state that it was in. It likes to go back. It follows the path of least resistance. We want to train it to not do that. So we use retainers on the teeth to help kind of set those changes in. And we wait essentially for the cement to dry, if you will. And that two-step process is really, really important to help the body change how it works. So, I joke with my patients sometimes, if you have a cavity and it hurts and you go to the dentist and they take the cavity out, they put the filling in, you don't stop brushing your teeth now, right? Now that they fixed the cavity problem, right? You've got to continue to do things to make sure that the cavities don't come back, because they will if you stop taking care of yourself. So just like eating healthy, right? You can't just, I'm going to eat a salad today and then tomorrow I'm going to go eat 6 pizzas. That's not going to, you're not going to win that way.
Well, I think the approach to integrative care should be like that. Like the medical space, your analogy with the cast and everything, it's one approach. But when we're working with integrative care, oftentimes there's no end point. There are just,
right.
Sorry for saying the word, but just adjustments as you make,
yes.
Going along the way, with whether it's diet, whether it's exercise, you're making these adjustments and, hopefully continually moving towards better health. We're going to take just a quick break here. Everyone will be back in just a couple of minutes to continue this conversation.
You are listening to The Health Hub here on Radio Maria Canada. A Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Cathy Biase.
Welcome back. We are talking with Dr. Glenn Jaffe, and we're going to continue on illuminating the world of chiropractic work. We touched upon, or I didn't, but you did, touched upon a bit of the nervous system. I think it behooves us all if you could give us a little bit more in-depth understanding of just what the nervous system does and impacts, the global view.
Sure. So as we said, the brain, the nervous system controls and regulates every function in our body. If the brain wasn't there, nothing would happen. Nothing would exist, right? However, we do know that the body and via the brain, the nervous system is designed to heal, and it's designed to adapt to its environment. So here's what I mean by that. Let's say it is the middle of August and we are in Las Vegas and we are in our air-conditioned hotel lobby and it's 71 degrees. I don't know what that is Celsius for your Canadian listeners.
Yeah, we swing both ways. It's okay.
You walk outside and it's 115 degrees. What happens to your body? You start to sweat, right? Did you have to think about starting to sweat? No, you didn't, right? Your body was adapting to its environment. The brain noticed the temperature change via the information coming in, and it is programmed to, when this happens, I'm going to do something to cause the body temperature to change, or excuse me, I'm going to do something so that the body temperature doesn't change so that I stay alive. So what does it do, right? You start to sweat. And when we start to sweat, that's the body's ability to try and keep the temperature at a certain, in a certain range. So we joke we don't have sweatitis when we walk outside, right? The body's responding to its environment. So if the nervous system wasn't capable of doing something like that, we would die from that stress of heat. And another one of my analogies I use with our patients is, our body has the ability to heal and function. And if it wasn't, we would have died of the stress of a paper cut a long time ago. And everybody laughs and then they go, yeah, you're right, actually. Right, because the nervous system does its job. We don't have to think about it. If we were in charge of thinking about digesting our food or breathing while we were sleeping, again, we wouldn't be here right now. When that system doesn't work efficiently, doesn't work well for a variety of different reasons, different stresses, it doesn't do its job. And that's when we start to get symptoms. So there's generally in chiropractic, we look at it, there's three kinds of stress. There is physical stress. And when I say stress, I want to make this clear that stress is good and bad. Stress causes the body to do its job. And sometimes we want stress. As an example, we go to the gym, right? We lift weights, we run, we stress our body, but we are trying to get it to respond to that stress in a way, right? We lift weights because we want to stress the muscles to get stronger. So we have different kinds of stress that cause the nervous system to respond. So a lot of times in my practice and a lot of chiropractic practices, we treat people that sit in a desk chair at a computer for 8 to 10 hours a day, 5 days a week, 50 weeks a year for years and years and years and years. And that repetitive stress of sitting puts a lot of stress into the spine. When those joints stop moving correctly because they are under abnormal stress, the nervous system takes that information, has to deal with it. And what comes out on the other end can be headaches. It can be low back pain. It could be asthma. It could be indigestion. The body is trying to tell us that there is a problem. And then when the system doesn't work correctly, that's when we get symptoms. The other kinds of stresses that can occur, we have emotional stress. We all understand what that means. Good things and bad things happen. We get filled with the stress of a disease diagnosis or a loss of a loved one, or the elation of winning the lottery or finding out that you're a grandmother. Those kinds of stress too. Your body's responding to it. You get that butterfly in your stomach feeling. That's your nervous system doing its job. And then there's a chemical stress, which can be controversial, but the reality of it is anything that's foreign that goes into your body is a stress. It is foreign and it will cause your body to respond, whether it's food, whether the quality of food is high or low, or whether it's something in the environment, something we inhale, a chemical, a medicine, a vaccine, anything that goes into the body that's foreign will cause the nervous system to respond. So, integratively, we understand why a diet and health is so healthy and so important, why taking care of your mental capabilities and your strategies for, understanding your emotions is so important, why mindfulness is so important, why stretching and exercising is so important. All these things that unfortunately the medical model hasn't really embraced very well. And when we understand that we can approach the nervous system this way, that's when function improves. That's when health improves. That's when eating better is better for you because your body can handle that food better.
Couple of things that just popped into my mind space. You talked about the digestive system. You quickly mentioned sleep. So chiropractic work for longevity seems to be something, when you talk about muscle joints and stiffness, you want to be able to move well when you're 80, 90 years old. All of this comes into play. All of the health of the body comes into play. And chiropractic work, to me, is undervalued in the longevity space. Now, I guess following through with that, should chiropractic work be considered a preventative integrative modality?
Absolutely. And we can, just from the pure biomechanical perspective that you bring up, to have joints move, to have flexibility and range of motion in tissues, the only way joints will continue to move correctly is if they can move correctly. And I know it sounds like a little innuendo there, but when things don't move over time, the body will lock them down because it doesn't view them as being necessary. And then the abnormal stress builds. And over time, the body responds to that abnormal stress. So I'm going to give you another analogy. I'm becoming the king of analogies here. But when you have a tissue in your body that's under abnormal stress for a long period of time, the body actually starts to change the tissue in response to that stress. So we think about if we do a lot of work with our hands, or if we're a gardener, we do a lot of weightlifting, we get those calluses on our hands, right? And if you put your fingers down and feel them right now, even if you don't do a lot of that work, you can tell that that area right where your fingers are at your hand, the skin is rougher there. If you go home and you find someone who's a child who's 6 and you rub your fingers there, you're not going to feel that callus. And that's the body's response to that stress. It's responding in the way that it's programmed to. So if over time we keep the joints in our body and our spine specifically moving as best as we can, the chance of arthritis, degenerative change, is going to be significantly reduced. The more degenerative change or arthritis we have in our body, and when I say arthritis, I'm referring to osteoarthritis, which is the most common and most pervasive, and that is the one that's typically associated with age, that the incidence of that is going to be significantly reduced. Is it going to never show up? Absolutely not. There's no way to prevent it, but you can do things to mitigate it at a very high level. I have patients who come in. I can think of one right now. She's 83 years old, and she still plays golf 3 days a week. You can do that down here in North Carolina in the winter, but she's a machine.
We do it with a colored ball up here in the snow.
She gets on her bike, her Peloton, and rides every day. She does the leg machine, and she plays golf 3 days a week. And she's so fit, and she keeps going. But she understands that regular chiropractic care, along with everything else, it's going to continue to keep her quality of life as high as she can keep it for as long as she wants. And ultimately, I think, like you're saying, Cathy, quality of life as high as it can be is everyone's ultimate goal.
Well, movement is key. I mean, we talk about that all the time, but where you fit in, and you can certainly correct me if I'm wrong, you're giving the proper pathways and laneways so movement can happen efficiently, effectively, and with as least amount of pain as possible. Is that a correct analogy?
Absolutely.
Excellent. One area that interests me a lot is, and when I was looking on your website and everything, you have a little one on your table. How young can kids come to see you? Kids, babies, infants?
Well, the youngest person I've ever adjusted was 5 minutes old.
Oh.
It was my oldest daughter. We had a water birth. And as she was born, I got to greet her and bring her into the world. It was probably my Mount Rushmore of events. That's probably one of them in my life. But after I received her and put her up on my wife's chest and she nursed her a little bit, I went up and I checked her atlas, which is the top bone in her neck. Birth is one of the most traumatic and potentially long experiences we will have in our life. My oldest daughter's birth was, unfortunately, my wife was in labor for almost 40 hours. That's a whole nother story. But I was able to feel, and the atlas bone, which is the one right below our skull, was not aligned correctly. And all I did was, with the tip of my pinky finger, I just touched it very, very gently, with less pressure than I would if you were touching a very ripe tomato to make an indent in it. And just that little tiny bit, and it just shifted just a hair, just kind of melted a little bit, and that was it. And so birth is really the best time to get adjusted, because you're starting life off the right way. You're reducing interference. But any age really, but yeah, I see a lot of kids that come in, sometimes right after birth, sometimes a few months in. And there's different milestones and things that happen in their development. And if you're a mom or a dad listening to this, you know the progression of being a newborn to an infant to a toddler to walking. There's a lot of things that can happen, and there's a lot of developments that happen that we want to walk alongside that baby with to help them reach those milestones and keep going as best as they can.
And it can impact, adjustments in a proper alignment of the spine can impact at a very young age, digestion, sleep. Do you recommend that parents bring, in a preventative space, I would say, that parents take their child to a chiropractor or a baby to a chiropractor? It's a scary thing for some, I would imagine.
It can be, because a lot of it is because of what's unknown. Excuse me. If we think about, again, all those shocking videos that we see in the movies and things, that's not how chiropractic is applied to infants and toddlers and children. It is the same approach. We are trying to affect the same change, but we are using a different tool, if you will. We use very gentle adjustments, and when we adjust kids, generally, like I said with my daughter, it's what we call a sustained hold, or we just hold a little tiny bit of pressure and allow the body to adapt to that, and you feel things change. The reason for that is that kids have not been around in their life on Earth experiencing stress like adults do. So their tissues are very, very, very easily changed. And then because of that, we can see a profound effect on their nervous system by measuring function change in a very quick way compared to adults. Children that are brought into me, I can give you an example. A couple of weeks ago, we had a little guy who was about 3 weeks old, and he was having trouble breastfeeding enough where he was getting enough food. So the mom was able to breastfeed on one side, but she would turn around and try and get him to latch on the other side, and he wasn't latching very well, getting a lot of air in, and he was spitting up a lot. And as a result, he wasn't growing as quickly as he was. He wasn't putting on weight like he was supposed to. We found out that he couldn't turn his head very well to the left as opposed to turning it to the right. So if he couldn't turn his head in a way that he could latch onto the breast correctly, he wasn't going to get what he needed. So what we did was we very simply and gently created some change in how his upper part of his neck and his head was turning with adjustments. I gave the mom a couple of different strategies to do. And in about a week's time, he was feeding like a champ, sleeping like a champ, and not throwing up much at all.
I think that's fascinating. And I don't think chiropractic work is the first place that new parents would go to, or any parents actually for young ones would go to. I think it's a really important point to be made. Very, very important point.
Yeah. Now, and Cathy, if I could follow up with that real quick, there is a lot of specialized training that some chiropractors will engage in to understand how to apply chiropractic to infants and prenatal and postnatal situations. And there are a lot of doctors out there who have this training. So if you are interested in looking for a doctor near you to provide this care for your child, make sure that the doctor you choose is understands, because chiropractic in kids is different than chiropractic in adults. And like I said, it's the same outcome we're trying to achieve, but there is a different approach to it.
Well, thank you for pointing that out. I think it's really important. Let's talk about you as you evolve as a practitioner, as you evolve, from your practice. What are you doing outside of adjustments and working with patients?
I realized early on in practice that no one is going to come save the chiropractors, and no one's going to be our voice. And if no one's going to be our voice, then our patients ultimately will not receive the care that they deserve or that they should get and have access to. So I have been working a lot with the North Carolina Chiropractic Association for almost 10 years to help the voice of chiropractic so that we can serve more patients and that more people have more access to care here in North Carolina. And I served on the board of that association for 9 years, and I served 2 years as president. And recently I was elected to the board of a national association called ChiroCongress. And here in the United States, we have over 50 state associations, and most of them are members of ChiroCongress. And our job in ChiroCongress is to support those state associations so that they can do that work on the ground in those different states. And I feel very compelled to do that because I feel so passionately about what we do in chiropractic, and that it deserves to be available to more people. And the more we can take that message and share it with other people in a way that makes sense, and they can see the results, and they can see that chiropractic is something that needs to be an equal part of the healthcare model, not just a fringe part, and not just used for, like we said, neck and back pain, that there's so much more to it. And that voice needs to be heard. And I want to keep carrying that banner. And I enjoy that work. I enjoy talking to people who maybe don't understand what chiropractic is all about, and giving them information and watching them change their mind. It's really fascinating, but I just enjoy the advocacy work, and it really is. It's a lot of fun for me too.
Do you see a shift at all from, generally speaking, do you get referrals from medical professionals? Is that something you do? Okay. I do. And that's probably the biggest thing that I've seen change in the last maybe about 10 or 12 years. Mm-hmm. As the newer medical doctors come in,
and kind of establishing themselves and become the majority of doctors out there. They don't have the same preconceived notions that maybe the previous generation's medical providers were given or assumed. Now, it doesn't mean it doesn't exist, but it's definitely, there's a lot more integration and referrals. In my practice, we work back and forth with pain management doctors. We work back and forth with orthopedic doctors, midwives, doulas, birth professionals, pelvic floor PT, massage therapists. I have a couple dentists that I work with. So there's a lot of it. The struggle that I see in the United States and maybe in other parts of the world too is the hospital systems are getting to the point where they control almost every primary care practice out there. And it's tough for the providers to step out and refer to patients that aren't, or to providers that aren't in the family. And so that's probably the biggest disadvantage that the patients have, is that they aren't given the choices that they could for that reason. So I think that's one of the relationships that needs to be worked on both sides.
Well, that's why we're doing what we're doing here today, is to give people the knowledge and the tools. And I've always said, if you can ask the right questions, you'll be going down the path to getting the right answers. And you can't just blame this, in my opinion. We can't just throw this all on the medical profession. We need to take responsibility for our health. Just like if you were learning to do something, learn about your health, learn the modalities out there, and ask questions. And when you start asking questions, you'll start getting answers. We have to take our health into our own hands. Thank you so much for being with. This has really taught me quite a bit today. If people wanted to, I know that people in Canada really can't go once or twice a week to see you, but is there, can people contact you to maybe get some more information about chiropractic, or maybe even just to, what should I be looking for in a chiropractor here?
Absolutely. The best way to find a chiropractor, or really any kind of provider, unless you have a referral, ask around, ask your community, ask your tribe. Who do you go to? Who do you see? Who do you hear good things about? And listen to the answers. If you start to hear, Dr. Smith's practice, Dr. Smith's name multiple times from people, then that might be a place you want to go explore. But just like anything else, go check them out online, go see what their social media looks like. Does it look like the kind of practice that you want to be a part of? Does it speak to you? Don't just, pick them out of your insurance panel, or just don't pick them because, they're 2 stops down from your house. That may not be the right place for you. And if you go somewhere and you find that you don't click with them, then change. It's okay. You've got to do what's best for you. And sometimes we have patients come into our office and it's not a good fit, and that's okay. I want them to find the best place for them. So we will try and do our best to connect them with someone who has what they are looking for, who can serve them better than I can. I have no ego with this. There's too many people out there that I know haven't even seen a chiropractor. So I want to do my best. And I know that's the best way to do it. So that's what I would say. If I can help you find somebody near you, please reach out to me. I know people all over the country. I know some people in Canada. I have a lot of networks that I've created by doing this work with the associations, and I'd love to be able to help your listeners or anybody get you connected with somebody that can take care of you. Our website, I think, is in your show notes. You can reach out to us on social media, on Instagram or Facebook. Send us a message there, and be happy to help any way I can.
Yes, the show notes will have all the contact information. Thank you so much for taking the time today to be with us. Very enjoyable conversation.
Thank you, Cathy. I appreciate the time, and I hope everyone has a great day.
Everybody, we'll talk to you next week on the Health Hub.